Administration of the second dose Pfizer vaccine began yesterday.
The second floor of the Infectious Diseases Hospital is being retrofitted to be used if the need arises. In total, the hospital can accommodate over 200 patients. These stories and more in today's COVID 19 update.
Right now, we have 151 cases in hospital or patients in hospital. And of that 151, we have 97 at Ocean View. We have, I think, 36 persons in ICU. Our capacity at Ocean View is 204 patients, so we haven't gotten to full capacity as yet. We are hoping that we don't have to be there. But nevertheless, we have been making some additional preparations if we have to go to that full capacity. Right now, at the second floor of the Ocean View Hospital, we have just put in piped oxygen. Before on that floor, we used to do from these 1,000-pound cylinder oxygen. So we're changing that, and now we have piped oxygen. That work is going to be completed this week, so that whole floor now would have pipe oxygen. So we're preparing for if we have a surge in more cases or more people needing hospitalization, that we can probably have the full capacity of 204 persons there.
Minister Anthony says the donated field hospital from Qatar will also be set up if the need arises. That field hospital arrived in the country earlier this year to aid in Guyana's fight against COVID 19.
We have started those preparations to put the field hospital in place. That would be, with that, we'll have an additional capacity of about 60 persons. At the regional hospitals, while we have been treating COVID patients at each of these regional hospitals, we have been looking at how we are going to expand the capacity at each of these facilities and the teams that would be managing patients in each of these facilities. We have done an inspection in West Demerara Hospital, and we know that we can increase from its current state to manage close to 40 patients over there, so that would be an increase in its capacity. Similarly, we are looking at Sadi and Region 10, Region 6, the Maikoni Hospital. More recently, we have looked at Region 9. We have added an ICU component in Lethem Hospital, where we have 6 beds. We also have in Mabaruma, we are looking at how we can complete as quickly as possible because that hospital is undergoing some repair. But at Port Kaituma, we have both an isolation facility and inpatient facility. And currently we have about 20-something people in that hospital. I think 6 of them needing hospitalization, the rest of them in isolation. So we have been adding capacity, building out this capacity, and hopefully we wouldn't need all of it, but we are preparing nevertheless. As of yesterday, with the adult population, we have 350,182 persons who would have received a first dose of the COVID vaccine, so that's 68.3% of our adult population. We have 180,922 persons that would have received a second dose of a COVID vaccine, and that's 35.3% of our adult population. And with the children between 12 to 18, we have 21,299 persons who have received either a first or a second dose, and that's 29.2% of that population. We just started yesterday, we started the second dose, so we did about 201.
Today's Mythbuster: everyone who wants to receive a COVID 19 vaccine must first do a PCR test to ensure they are COVID free.
No, that's not necessary. So if you want to get a vaccine, all you have to do is come to the vaccination site. We have about 103 or 106 fixed sites, and we do have mobile sites. So come to any one of them. There's a checklist that the person who, before they administer the vaccine, they'll go through a checklist with you. And this is to find out about your past medical history, your history of allergies, and maybe a history of some comorbidities. And once you go through that, then they'll be able to give you advice whether you're eligible or not.
Well, that's it for today's COVID-19 update. We just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.